Hi, Isabel. How are you? Good. I'm good, thank you. Are you ready for tomorrow? Nice. Let's see. So far, it's just you and I. Do you have any questions about anything? I was going to do like a question and answer thing. If not, I was just going to do kind of like a general educational thing about neurotoxins. But if you have something specific you'd like to ask. Oh, okay. So real quick, I'll start off with some things that I have going on as far as like on the business side end of things. If you didn't know already, I have scheduled some time to be in Stewart every Friday. I'm at Max's Shave Room, so that's in downtown Stewart. And I basically bring everything I need to the barber shop to treat people. So based on appointments and stuff like that, I can bring more. Like if somebody wanted to do an IV or if somebody wanted to do PRP treatment, then I can bring that stuff if needed. But usually I always bring Botox, Xeomin, Dysport, and then fillers with me, and then a variety of vitamin injections. And then also semaglutide if anybody wanted to do a weight loss consultation, I bring that too. So just if you're not able to make it up to Port St. Lucie, I am in Stewart on Fridays from 9 to 6, and that's at Max's Shaving Room. So if that's a little bit more convenient for you, we can arrange to meet there. The other thing I wanted to go over is if you haven't seen it yet, you can, I'll post the link after this, I'll post it after the live, but I just got a new AI virtual tool. I don't know if you've seen it. So basically when you click on the link, you take a picture of yourself and then you can tell it like things you're interested in doing. So I'm interested in lip filler, or I'm interested in Botox for my eyebrows. So stuff like that. And it will show you like the before and after of what you would look like with whatever you pick. And you can even do cheek filler, a liquid rhinoplasty, under eye filler, Botox for the glabella or around the eyes, or a lip flip, right? You can do all those different things, and it'll take your before picture and it'll show you what you'll look like after, and you can like toggle in between the two to look at the differences. And you can save them to your phone, you can save them to me, and then that way when you come in for your treatment, I can kind of see what you were looking at and what your expectations are, and we can go over that. And then after you have the treatment, I can take after photographs and we can compare it to what the AI generator told us you might look like. So it's a pretty cool tool. I haven't really seen many places using it. So I'll put the link in. I'll put it into both the Instagrams and both the Facebooks today, later. So if you guys want to try it, you can just click on it and see what you'll look like, whatever you're flirting with doing. So it's kind of a neat tool. I played with it for a while just to see what I would look like with different things, but it's pretty fun. And my husband played with it too, and my kids. So it's kind of cool. So I'll post that afterwards and you guys can play with that too. Otherwise, Liz, hi, thanks for joining us. Do you have any specific questions you would like for me to answer? If not, I'll just kind of go through like a general educational thing about neurotoxins. All right, I'll just talk about neurotoxins then. So I carry 3 different kinds. There are many more, but currently the 3 kinds that I carry are Botox, Xeomin, and Dysport. Okay, listen. So Botox is like the brand name. Everybody knows it. Everybody's heard about it. It's the one that's most popularized. It was the one that was used at first. And what it was used for in the beginning was people who had like contractures. So contractures are like when you have these tendons or these muscles that just cramp up or are tight, really tight like this. So they were using it, you know, like cerebral palsy victims or stroke patients or people who are burned really badly. They get like these really tight tendons and contractures. So they were injecting it into those areas to kind of give those people some relief. And then somewhere along the line, a doctor was like, oh, I wonder if you put this in your face, what it does. So that's when they started using it for the glabella and the forehead. And that was the only place it was approved for many, many, many years. And then as time went on, then they said, oh, you can do this for migraines, or you can do this for TMJ, so stuff like that. So it started getting more FDA approval for broader uses. So of course, after that happens, there's always going to be competitors, right? So the next competitor up was Xeomin, and Xeomin is very comparable to Botox. They're both botulism type A. That's the toxin that's used. So they're both the same neurotoxin molecule. They are manufactured differently, and that's where the differences come in. So if you see commercials for Xeomin, you'll see them call it the clean tox. So that's what they're referencing. They're referencing how it's the filtration process for it. Botox, the way it's filtered, the neurotoxin molecule still has some proteins that are attached to that neurotoxin, and that's fine. But what that can lead to is the possibility to have a resistance to Botox. So you'll see people who have gotten Botox for many, many, many years, and then all of a sudden it doesn't work for them. So what's happened is their body has developed antibodies, but it's not to the neurotoxin, it's to the proteins that are attached to the neurotoxin. So that's why when you switch to a different one, and then it works again, because those proteins aren't there. So specifically with Xeomin, there are no proteins attached to the neurotoxin. It's just the neurotoxin molecule. So that's why you see it called the clean tox on the commercials. So that is one reason Xeomin would be beneficial for some people, because it's just the neurotoxin, so you'll never develop a resistance to it. The other reason I would choose one over the other is that because of that filtration process and that there's no proteins in there, I like to use it for people who have autoimmune conditions. So like MS or RA or lupus, those kinds of things, because these people are already in like a hyper-inflammatory state, like their body is already like, you get sick a little bit and it causes this giant flare-up, you know. So what worries me about doing a toxin like Botox is that those proteins could cause that flare-up if their body has a reaction to it. So I prefer to use Xeomin for those patients because the risk of me setting off this hyperimmune response is much, much lower. The other benefits of Xeomin to Botox is that it's cheaper. So, and it's equal to Botox, so meaning like 1 unit of Botox is equal to 1 unit of Xeomin, and they last the same amount of time. But generally, at most places, you'll see that it's about $1 cheaper a unit. So I'm like the Publix or Walmart brand kind of girl, so instead of buying Kellogg's Rice Krispies, I buy the Publix one because it's $3 cheaper. So in my mind, I would use Xeomin instead of Botox just because it's cheaper. So the other thing is that Xeomin kicks in, and by kicks in, I mean starts activating or deactivating the muscles, like where they don't contract anymore, around 5 to 10 days, whereas Botox takes about 10 to 14 days. So those are kind of the differences between those two. Some people have been getting Botox for a very long time. They like the way it looks. They like how they respond to it, and they're used to it. and we are creatures of habit, so they just keep getting Botox, and that's fine. But if somebody came into me and had never done it before, I would probably recommend Xeomin over Botox, just because of those reasons, for it kicking in faster and that it's a little bit cheaper. So if you can save money, save money. So the third one that I carry is Dysport. Dysport is by a different manufacturer, and Dysport is a little different in a couple ways. Dysport is different in that you'll see like 1 unit of Dysport may be $5 or $6 instead of $12 or $11 like Botox and Xeomin, but that is because I've got to use twice as many units to get the same effect for the same amount of time as the other two. So like typically for the glabella, I would use 15 units of Xeomin or Dysport of Xeomin or Botox, but with Dysport, I would have to use 30 units. So that's why there's such a big price difference between those ones. Otherwise, it's still a botulism type A neuromodulator. There is a contraindication for Dysport, meaning there are people who can't use Dysport, and anybody who's allergic to eggs shouldn't use Dysport, because the proteins that are in there are comparable to egg proteins. So that is something you need to take into consideration if you're wanting to get Dysport. Dysport also kicks in much, much sooner. So usually that's around 2 to 5 days where it kicks in. So this would be beneficial. Say I have somebody who came in on a Friday or Thursday and they're like, I'm leaving on a cruise on Sunday, and so I want this to be kicked in. Then I could say, well, let's use Dysport, because that's going to be kicked in by the time they go on their trip, right? So the other way, or the reason that I would recommend Dysport over some of the others, is because Dysport tends to tolerate or withstand people with higher metabolisms. So for instance, I have some physique girls or bodybuilding people who come to see me, and I would recommend Dysport for them. Their metabolism is much higher. They're in the gym twice a day for like 2 hours each time. So I would prefer Dysport. If I use the other two, by the time it kicks in, it'll last a couple weeks and then it'll be gone. And Dysport, they'll probably get about a month, maybe a month and a half out of it. So that would be a reason I would recommend Dysport over the other two. These guys who are contractors or construction workers or stuff like that, these guys who are out in the heat a lot, I like to use Dysport as well. I like to use Dysport in men in general because it has a different look. Botox and Xeomin are like, you are like frozen, and Dysport is a little softer. So you still have some movement, it's just not enough to create these like static lines where the lines are there regardless of if you're making that facial expression or not. So Dysport's a little softer, so people like policemen, lawyers, doctors, nurses, teachers, I like to use Dysport because they're in a profession where it's important for people to look at them and kind of understand what they're feeling, right? If a teacher's upset at their class, the kids should be able to look at her and realize that she's upset, as opposed to looking at her and being like, I don't know if you're joking or if you're mad, I can't tell because nothing's moving on your face, right? So that's why I would recommend Dysport over the other ones. So they're all just different, and it just depends on your preference, what kind of look you're going for, and kind of your metabolism and your medical conditions, right? So that every consultation I do, I have that same conversation with everybody, and then we can kind of decide which one is best for you and your lifestyle. So those are the 3 toxins. So now I'll cover maybe some places that people don't always know that they can get a neurotoxin, right? Everybody knows, most people, 98% of the people I do, they come in, they get their glabella done and their forehead. I have one client of mine that calls this her bitch lines, which is hilarious. So I like to refer to it as that sometimes. You can do it around the eyes. You can do it like in the tail of the brow that kind of lifts the brow up. This muscle contracts this way. So by relaxing these muscles around the eye, it will help give you a little bit of a brow lift. So that's good for some people who've got like a little bit of a hooded eye. You can also do it underneath the eye. When people smile, you get like this little roll right here. It's called a jelly roll. And that's just that bottom eyelid muscle contracting. So if you just do a couple units right there in that muscle, now when you smile, it doesn't contract as hard, and then it will soften the lines under your eye. There's a test we do before I do an injection there. So as we age, your skin gets a little more lax, it's a little more loose, and your muscles aren't as strong. So if I pull your eyelid down and let go, and it comes up really, really slow, then it's not a good option for you to get that Botox under the eye. So it's called a snapback reflex. If it's slow, then and you do a toxin there, it's going to cause like a droopy look, right? Because that muscle's not tight enough to support it. So there are people who that's not a good idea for. The other places you can get it, people probably have heard, is in the masseter muscle. That's this big muscle right here. People who clench at night or grind their teeth or just have TMJ, that's a good option for them. It also will help slim the face, and for females who are looking for more of that heart-shaped appearance to their face, that's a good option for them, especially if they're clenchers, because that, like you can see mine bulging out right there. So that kind of gets rid of that and gives you that more heart-shaped appearance. So you can do it for aesthetics as well as medical reasons for that muscle. Other areas you can do it, which a lot of people don't know, are in the nares, like the sides of the nose right here. So when I don't even know if I can do it. Like when you flare your nostrils, some people's nostrils flare when they laugh or when they smile, and it gives you the appearance of this wider nose. So you can do a little bit here, and that kind of narrows the nose a little bit. The other place you can do it is right here and right here. So sometimes when people talk or smile, this muscle kind of wraps up towards the tip of the nose. So when you talk and smile, it will pull the tip of the nose down. And most women in particular are looking for a little bit of a raised tip to the nose. So you can do a little bit under there, and that will take care of that. It will stop it from hooking down when you laugh or when you smile. Other places you can do is right here on the sides. So some people, when they smile, their top lip comes up really, really high, and they call that the gummy smile. So you can do a little bit right there, just a little bit, just to kind of soften the muscle. We're not completely paralyzing the muscle. Just so when you smile, these muscles, these levator muscles, aren't pulling as hard, and it'll give you, just in general, like a less gummy show to the smile. Other places you can do are like right along here, and usually what I do there is like a microtox for, they call it smoker's lines, right? But everybody gets them just as we age. In general, mostly women, right? Because of course we're the ones who don't want wrinkles, so of course we're the ones who get them. So I can do a little microtox here that softens that muscle. It's very superficial, so when that muscle contracts, it softens those lines like that. The other thing a lot of people do is a lip flip, and that's right along this vermilion border. It's 2 injections on both sides. That softens that muscle right there. So now when you smile, some people's lip will curl in like that. So they have a nice full lip, they smile, and it goes away, right? So you can do a couple of units right there. So now when they smile, that doesn't contract as hard, and they still have a nice full lip when they smile. You can do the bottom lip too. It's not as common. Most people's bottom lip doesn't curl in like that, but some people's does. So I'll do just a touch right there. Most people, 99% of people, is the top lip. Other place you could do is right here. This muscle is called the DAO muscle. It's a depressor muscle, meaning it pulls down. So like that, right? When you're sad, that's the muscle you see. So also as we age, your muscles, all of the muscles in your body shorten with age, shorten and tighten. And that includes the ones on your face. So these ones shorten and this one shortens, and that's why you see these like older ladies like just with like a permanent grumpy face. It's because those muscles have shortened. So you can do a little Botox there, and it will help the corners of your mouth kind of turn up a little bit, give you more of like a pleasant appearance, right? Instead of just walking around looking like pissed off all the time, right? The other place you can do is right here in the chin and the mentalis muscle. Again, that muscle can shorten up and contribute to that grumpy face, or we call it a witch's chin, or some people say chinulite. They get chinulite. So you can do a little in the chin, and that softens that. it does a couple things. So it helps with that grumpy face. It helps with any lines that you're getting right here. And it also helps like with the jawline because you're relaxing that muscle. And so you're elongating that jawline a little bit. So that's the face, right? There are many, many different areas you can do. I could do it along the neck for tension headaches. I could do the back of the head also for tension headaches, like parietal headaches. I do a lot of injections like right in the back at the base of the skull. And then you've seen trap tox or Barbie tox. So that basically is just along the trap muscle. Some people just have very tight trap muscles and that helps with headaches and they do it. Other people are looking for that elongated neck. And so what happens is after you do that for a while, that muscle atrophies, meaning it kind of shrinks because it's not being used, right? So like if your arm is in a cast for 6 months and you get the cast off, it's like super skinny compared to the other arm, and that's because those muscles haven't been used, they haven't been worked out for 6 months, so they shrink. And that's the same concept that's happening when we do that trap tox or like the masseter tox to slim the face or to elongate the neck. It's because those muscles are atrophying, and so it changes the shape of your silhouette, right? Other places you can do are along the jawline here and just underneath the jawline. So when you like clench like that, you have all these little bands that come up. Those bands are part of a muscle that's called the platysmal muscle, and it's like a sheet muscle that goes around your neck, and the ends of it come up and curl and hook just onto the lower mandible there. So that muscle is also a depressor muscle, meaning it's pulling all the time, right? So when you do that, it's pulling down. So if you do a little toxin right there where that muscle ends, and right here underneath the jaw, we're relaxing that muscle, so it's preventing it from pulling down, and that tightens up the jawline, right? Because it's not pulling anymore. So that's called like the Nefertiti neck lift. So that's another area you can use it. I also use it on people who have like persistent knots. We call it like a trigger point injection. So I'll mix a little bit of Botox with some lidocaine, and basically right where you've got those trigger points when you push and it hurts really bad, I can do a little bit of Botox in there with some lidocaine. The lidocaine will give you immediate relief, and the Botox will help to relax the muscle for a longer period of time. So there's many other uses for it, but those are just a couple. I've seen some women now who are doing it in their calves to slim their calves down. That's kind of extreme, but that's a thing as well. Hyperhidrosis, so that's a condition where you have excessive sweating, and it's excessive. I mean, not a normal sweat, like when you go out for a jog and you sweat. These people are sweating just sitting. It's dripping sweat, right? So that's hyperhidrosis. People can get that in different areas. They can get it on the top lip, they can get it under the arms, they can get it in the hands, they can get it in the feet, they can get it in the groin. And I can use hyperdilute neurotoxin at a very superficial level, and basically what it does is it paralyzes those sweat glands. So it decreases the sweat immensely for these people, and that is a life-changing thing for them, right? Because they can't wear certain shirts, or they can't shake people's hands, or they have to buy certain shoes because it's a constant, like, they're constantly wet, it's constantly sweating. So it's miserable for them. So these kinds of procedures for them are life-changing. I treated a kid a couple weeks ago, and I see his mom pretty frequently. She comes in pretty frequently for different treatments. And she said he used to take, I think, 3 t-shirts with him to school to change throughout the day because he sweat so much. And he always wore black. And now he went and picked out like a whole new wardrobe. He just takes 1 shirt to school. Like, he's just a normal kid now. And he's like so thankful for that. And that's just, especially for a kid, that's a game changer as far as like when you go to school and people are laughing at you and stuff like that. So it works for that too. You can do it on the palms of the hands. You can do it on the bottoms of the feet as well. That one's a little bit more intense. I do some anesthetic for that, but you can do it for that as well, and it just paralyzes those muscles, those sweat glands, and it lasts longer. So it typically lasts about 6 to 8 months for those kinds of treatments. So it's not like your face or other places where you've got to do it every 3 months to kind of maintain it. It's a lot of Botox in a big area, and it lasts about 6 months. So I think that's all I've got on neurotoxin. If anybody has any like follow-up questions you want me to answer, I'll be happy to answer those. If not, I can just talk some more. My cat is yelling at me. Sorry. Okay. All right. Without further ado, I would like to, you're welcome. I would like to pick a winner for this week's live. Oh, the other thing I wanted to talk about is if this is something that people start enjoying, like these little live Q&A, like educational things. I spoke to a couple people in my field. One in particular, she's a chiropractor, and then another lady that does, she does facials and stuff like that, but she focuses more on acne, so like teenagers or adult onset acne, hormonal acne, that kind of stuff. But we kind of talked about doing it together where we could kind of have a conversation that you guys could be privy to, because typically like just her and I talking, you guys can learn a lot from those conversations. So if that's something you're interested in, I can start inviting people and we can have a conversation, and then you have a couple people from different fields of medicine that you can ask questions to. So that's just a thought. You guys let me know if you think it's a good idea, or we'll see where these go. I'll just keep doing them every Saturday and we'll see how popular they get. And if that's a thing, then we'll start doing that. All right, so I'm gonna pick eeny, meeny, miny, mo. Here, I'm gonna have my son pick. Liam, come here. Oh, we have, excuse me, we have a September special this month at the office for 20 units of Xeomin for $160. So usually it's $220, so this is a pretty good little discount. And 20 units of Xeomin, typically you can do this whole glabella here and a little bit in the forehead, or you can do it all the way around the eyes and maybe a lip flip. So a couple different options, just kind of depending on what areas you're wanting to focus on. So it's 20 units again for $160, and that'll be through September. And then October will be different. I'll pick something different for, obviously for Halloween, we'll do something. And then it's also Breast Cancer Awareness Month. So I like to do something for that as well. So stay tuned and I'll be sending those out. So Liam's gonna pick a winner. So one of those. Just pick one at random.
Okay.
My assistant.
Looks like it's gonna be.
What do we got? Trisha, you are the winner. So what did Trisha win? I think what we'll do, since it's September, October, it's getting into flu season and stuff like that. And Trisha, if this is something you're not into or you want to discuss, we can discuss that. But I think an immunity IV or an immunity injection, depending on if you're adverse to needles or not, would be a good idea. Kind of boost your immune system going on into the fall, to kind of help you prevent against illness, like all these colds that go around and the flu and all that stuff. So that's what we'll do for you, Trisha. I'll DM you, or you can DM me and I'll get your contact information and we can set that up for you. So it's an immunity bag IV. So it's got things that boost your immune system, right? So B12, B5, vitamin C, zinc, magnesium, and calcium. So all of that is in the bag. You relax in the recliner for 30 minutes or so and you get yourself a little immune boost. And that being said, if nobody else has any questions, we will end it, and then I will be here again next Saturday at 1. Everybody good? All right, guys. Thank you for joining. I'll see you next week. Give us a call if you want to set up an appointment for the special this week for Xeomin. And the number there is 772-207-0080. So we'll talk to you guys later. Thanks. Have a great weekend, guys.